Welcome back to Dog Hobby 2020. Please participate in the polls that appear on top right of your screen. For social message, please go to last 3.5 minutes of the video. Today's topic is hereditary spherocytosis. The videos on blood diseases will be incorporated in the playlist ICAR. Before we go to the topic, let us make ourselves a promise that we don't consume medicines unless prescribed by the doctor. Here we have a 19-year-old teenager residing in Tokyo came to OPD with complaints of yellowish discoloration of eyes. The patient complained no signs of conjugated hyperbilirubinemia like dark-colored urine itching. Family history is suggesting gallbladder disease in family showing a pattern of autosomal dominant inheritance. In autosomal dominant inheritance, 50% of the children of affected individual are affected. Birth history reveals pathological jaundice in first week of life. Patient shows no signs of gallbladder disease like upper abdominal pain, fever. Pallor and icterus are noted on examination. A mass was felt appearing on deep inspiration in left upper quadrant, suggesting grade 1 splenomegaly. Let us look into Hackett's grading of splenomegaly. Spleen is impalpable on palpation implies grade 0. Spleen palpable only on deep inspiration is grade 1. Spleen palpable midway between umbilicus and left costal margin is grade 2. Spleen crossing midway reaching umbilicus is grade 3. Spleen crossing umbilicus is grade 4. And spleen reaching pubic symphysis is grade 5. USG confirmed splenomegaly and gallbladder showed no evidence of disease. Hemoglobin was low with peripheral smear showing uniform small and dense red blood cells with no central pallor suggesting spherocytes. Reticulocyte count is increased suggesting erythroid hyperplasia of bone marrow. MCV is decreased, MCHC is increased. Unconjugated hyperbilirubinemia is present. Incubated RBC showed increased osmotic fragility. Direct antiglobulin test ruled out immunohemolytic anemia, which also shows spherocytes in peripheral smear. These lead us to the diagnosis of hereditary spherocytosis, most commonly autosomal dominant inheritance. In the patient, there is a defect in skeletal membrane proteins, leading to unstable membrane resulting in shedding. Surface area per unit volume decreases, and RBC assumes a shape of spear and is termed as spherocyte, which will have tough time in traveling through sinusoids of spleen, resulting in phagocytosis of less deformable spherocytes. This is termed as extravascular hemolysis. Normally, anemia is not manifested because loss of RBC through hemolysis is compensated by erythropoietin-induced erythroid hyperplasia, but this balance is lost when erythropoiesis is inhibited, like in Parvo B19 infection, destroying erythroid series of bone marrow. This is termed as aplastic crisis. Or folate deficiency can inhibit RBC production as folate is required for RBC production. This is termed as megaloblastic crisis. Or when there is increased hemolytic activity by spleen, termed as hemolytic crisis. Megaloblastic crisis can be prevented by lifelong supplementation of folate. Advice must be given on folate-rich diet, periodic screening for gallbladder disease, advice on splenectomy and prophylactic cholecystectomy at the same setting can be done if anemia worsens or when abdomen is opened for operations like appendicectomy. Prior to splenectomy, vaccination against encapsulated organisms must be taken. Let us go to our favorite part, that is social message for community. I will take opportunity to list the food items rich in folate, a very important vitamin for your blood, and how to introduce them into your diet, minimizing the problems they may cause. Legumes like beans, peas, lentils, leafy greens like spinach, kale, arugula, citrus fruits like oranges, grapefruits, lemons, limes, asparagus, eggs, beets, Brussels sprouts, broccoli, walnuts, flax seeds, beef liver, wheat germ, papaya, bananas, avocado, fortified foods like bread are good sources of folate, and let us look into them. In legumes, do not eat fava beans, snow peas or soybeans if you are having headache or on antidepressant medication. Do not eat fava beans and chickpeas if you are diagnosed with a joint disease called gout. Always eat cooked legumes Were you aware of the song Beans, Beans, the musical fruit? The more you eat, the more you toot. Funny that even a child knows beans contribute to flatulence. But let us not make it the reason for not having legumes in your plate. Because soaking legumes for 8 hours with frequent changing of soaked water and rinsing them just before transferring them into fresh water for simmering till the legumes soften enough to get crushed easily and chewing them properly before swallowing is a trick to stop flatulence. If you still face the problem, try different legumes as all legumes are not known to equally generate intestinal gas. Asparagus can make your urine smell weird. Air freshener in your bathroom should be able to mask odor. Do not eat broccoli if you are hypothyroid. Cooked eggs are nutritious compared to raw ones. Raw eggs, even with their shell intact, has risk of causing food poisoning. Egg yellow is more nutritious than egg white. I know you are worried about cholesterol, but don't. Eat 2 whole boiled eggs a day and they are not known to cause any adverse effect on your health. Do not consume them with other animal foods like bacon so that you don't add the cholesterol you fear. Beets may cause pink to red urine or stool. It is fine, but meet doctor if it is happening every time you eat beet or if something else is troubling you other than color. Citrus fruits are acidic and they spoil your teeth, so wash your mouth with plain water after consuming them. They can cause heartburn, and for social advice on heartburn, click the above pop-up for video. Walnuts can be consumed anytime, but interval between your daily medicines and walnuts should be 2 hours. Do not eat papaya if you are pregnant or if you have asthma. Do not eat flax seeds if you are pregnant, breastfeeding, or having gynecological problem, bleeding problem. Always eat cooked flax seeds and drink more water. Any liver should not be consumed by pregnant. For others, once in 2 weeks should sound good. If you know that you are allergic to certain foods, make sure products you buy or orders you place in restaurant do not contain that ingredient. Here are foods that cause flatulence, and if it is troubling you, seek your doctor's advice on modifying diet or medication. Are you pregnant or breastfeeding, hypertensive, diabetic? Proper diet plan and medical care should go hand in hand. Are you on warfarin therapy? Ask your doctor for a stable vitamin K diet. Do you love papayas or grapefruits? Tell your doctor before he prescribes you a medicine, because for some medicines to work properly, you may have to stop eating them as long as you take medicines. Comment below, share to the relevant, like and subscribe for future videos. Thank you.